The concept of self-care is a vital component of nursing and provides the best possible care for our patients. Providing quality patient care starts with the nurse's ability to care for themselves and stay healthy both physically and mentally. Nursing can often be a physically demanding job, but when these demands become too great, nurses become injured and fatigued, and their quality of work suffers. Worldwide, there is a high prevalence of lower back pain in the profession of nursing. Self-care by nurses begins with the following procedures to protect them against potential danger, including overexertion or unsafe patient handling practices. Nurses can make simple steps to reduce this chronic pain by refusing manual lifts that are unsafe and raising the bed for better posture and easier accessibility. The second most common injury in the nursing profession is exhaustion. Long hours and picking up extra shifts can lead to numerous mistakes in the patient care facilities. Nurses who are exhausted have impaired critical thinking skills and can become more susceptible to illness. Administration and nurses can work together to take precautions to encourage self-care and prevent injuries or fatigue that can lead to unhealthy habits and poor patient outcomes that could even lead to lawsuits. Malpractice in the nursing profession is on the rise. An average cost of malpractice suit, including claims, settlements, and court judgments, is around $170,000. There can be many reasons for malpractice claims, but some of the most common ones seen in the nursing profession include a failure of communication and medication errors. While it is known how important communication is in the nursing field, it is still a common area of negligence for nurses. Poor or incorrect communication between the nurse and his or her colleagues, charge nurses, and physicians can result in the patient being in harm's way. Nurses sometimes forget to express changes in lab work or vital data. It is also important to note that the lack of knowledge or experience does not protect the nurse from this negligence. Medication errors are another major cause of malpractice claims. Whether it is prescribed or over-the-counter medicine without a physician or nurse practitioner's knowledge, the risk of patient harm goes up extremely. If there is a malpractice claim from medication error committed by a nurse, the institution itself could be sued or the nurse individually sued for taking action not within the realm of nursing practice. To minimize this risk, it is important for the nurse to only give medications when there is an order from the physician or a nurse practitioner. The nurse can also be sure to follow the 6 rights: right drug, right patient, right dosage, right route, right time, and right documentation. Positive mental health is vital to a nurse when it affects the quality of life, interpersonal relationships, and care that the nurse is providing for their patients and also for themselves. Brought on by their daily tasks, nurses can suffer extreme stress from PTSD that can be caused by numerous legal and ethical encounters they witness or are a part of. This leaves them feeling helpless or fearful. They are often exposed to death, frantic families with extortionate expectations, and coworker conflicts, making them feel even more susceptible to high levels of stress. An abundance of demand on one nurse can cause stress and interrupt positive communication among coworkers, creating a hostile work environment. The lack of authority without interpersonal communication can lead to the piling responsibility, which can cause low productivity. Often this stress on a nurse's mental health results in burnout. The instance of burnout refers to the percentage of nurses who end up leaving the career due to stress-related issues that the profession brings. There are unfortunately a lot of things that contribute to a nurse's decision to resign from his or her position, and self-care is most strongly involved. In an intensive care situation, 16% of nurses feel as though their role is overloaded with more than what they are expected to do. Only 30% of these nurses cope using rational problem solving, whereas 63% of them made a decision to leave their profession. This is a crucial issue, and it is prevalent that the abilities and resources for the nurse to practice self-care should be emphasized more by the hospital. The most influential practices that can improve self-care for nurses within the hospital include more opportunities for feedback, improved support and supervision, and strengthening the mentorship between a student and the nurse. This especially ensures that the new incoming nurse feels comfortable and positive that he or she has access to coping strategies when the consequences of this profession becomes difficult to handle on their own. The most efficient way to promote self-care in nursing is to reduce personal life, work life, and environmental stressors. In order to promote self-care, nurses should utilize stress reduction techniques provided by employers, as well as techniques found outside the workplace. Healthcare employers are responsible for providing good management, adequate staffing, and supportive services, such as debriefing to facilitate the reduction of workplace stress. Furthermore, it is crucial that nurses take personal responsibility to promote self-care by reducing stressors prevalent in their personal lives. Utilizing resources provided by the profession, exercising and eating a balanced diet, and taking time to relax are all efficient ways to reduce stress and decrease the rate of stress-related burnouts in healthcare. Promoting self-care in the nursing profession is not only beneficial for nurses themselves, but for their patients as well. Learning self-care techniques can prevent mistakes and poor communication that stems from exhaustion, stress, or physical pain. Nurses who take better care of themselves mentally and physically are able to communicate with their fellow nurses better, as well as provide quality patient care.